The Longevity Investors Conference brings together a highly select audience of the most prominent investors in the field. It takes place over 2.5 days from September the 24th to the 27th in Gstaad in Switzerland. The main aim of these events is to bring together academia and business to discuss the latest trends and opportunities and to provide relevant insights into what's happening in the longevity, the clinical, the rejuvenation space. So speaking at the conference and representing academia will be Oon Chew Seng, Professor in Medicine of the National University of Singapore, and frankly, one of the most busiest people in the longevity space, Andrea Maier. And I'm delighted to say that she's with us today. Andrea, how are you?
Thank you. I'm not so busy as you. I think you are the busiest person.
Oh, get out of here. We're both busy. It's a great sector. And as we both know, this is really growing now. And the Longevity Investors Conference has been around for quite a while now as a stable part of the longevity investment agenda. But of course, you're representing quite a big community yourself, not only from the clinical side, Andrea, but of course the Southeast Asian community in the work that you're doing in Singapore. So how is Asia panning out now in the longevity space?
Great, I would say. I'm living and working in Singapore. Singapore has the highest life expectancy with Japan and Switzerland, as we all know. But what we see in Singapore, that there's not only a consumer drive, which we see worldwide, but there's also a huge investment from the government, really now facing a huge problem, I would say, a low fertility rate, a high lifespan, and really investing now into prevention. And I think there, Singapore is very unique and quite different also from other Asian countries, the neighboring countries we have. And that leads to a huge amount of investment, not only into research, but also in other domains here in Singapore. And I think that is really then reflecting also the Asian market. So I'm very pleased to represent Asia at the conference in Gstaad.
Yeah, and of course, we're both Europeans, and of course, many of the European countries have got really pretty challenging population pyramids, haven't they? And of course, Singapore is probably representative of some of the transition of the work that you're doing into the much wider context. So, do you see that translating the work that you're doing out of NUS? Are you seeing that that's being picked up by others around the world?
Yeah, absolutely. So Singapore's gap between healthspan and lifespan is, I think, the same as everywhere in the world, and that's what we try to achieve to tighten up. So lots of preventative programs are being rolled out in Singapore, but we also see worldwide, for example, in the Middle East, a couple of countries, but also now in Europe and in the US, that at least patches within these countries are now saying, okay, could we have a different approach? Should we optimize the health of individuals to prevent an age-related disease, which occurs later in life? So really tackling the health of individuals in middle life, and should we invest in that? So there are absolutely countries next to Singapore investing in a new arena of healthcare.
So let's talk about that investment. Now, obviously, there's investment at a government level, which I guess, we're seeing traction with that now. But given your perspective on the Longevity Investors Conference and the need to get capital in the industry, are you seeing a difference in investment appetite across different regions? And, you're traveling the world a lot.
Yeah, I think if you're looking at investment, you can either invest in really preclinical research, early drug development, but you can also implement already existing technologies where the consumers are really waiting for. What I'm seeing here in Asia, that there's of both, as in other countries too, but there's a huge consumer market with regards to supplements. But of course, this is also in other countries. I think what is missing a little bit yet in Singapore, for example, is really that early stage investment, which I see much more in America. So, but overall, I would say, taking a step back and not from the Asian context, if I compare it to 5 to 10 years ago, there's a huge investment. And I think nobody would have predicted so much investment in our field in 10 years ago. Because now we have, I think, we're getting a glimpse of that we can diagnose how old somebody is. We are bringing it into clinical practice. We have many longevity clinics around the world. We won't touch at the moment if they are really evidence-based on what we do, but the consumer market is there, and there with also investment really comes, I would say globally, including Asia.
Yeah, and let's talk about those clinics because, of course, very interested in the work that you're doing in the University of Singapore because that's a translational program that goes into the public directly. And I know you've been working on, a public strategy as well as obviously the private clinical strategy that's out there. There are a lot of clinics. We've identified now 200 clinics that are pure play longevity. They're not IV clinics. They're claiming their stake in the longevity agenda. But they're very much the frontier. The clinician is the frontier of this next wave of science that's coming through, but also the science that's available today. So how do you see the clinical acceptance of what's going on in longevity? Is it getting to the mainstream, or is it still a peripheral subject for many clinicians?
I think it depends who you ask. If you would ask my fellow physicians, I think they still do not accept that we should invest much more into prevention. It's very conservative domain in clinical practice. If you ask consumers, I think they want, and we already know that they want a new arena of healthcare. They want to prevent deterioration of their physical function. They want to be happy. They want to be productive. So I think we cannot neglect anymore that we are getting more evidence in terms of how we measure things, how we can intervene the body. That means also that we can, in my view, implement it into clinical practice. And that led towards implementation of health and longevity medicine in now already 3 publicly funded hospitals, and 1 is in Singapore, but also the Mayo Clinic in the US and Sheba Health. They all now have clinics running, seeing individuals who want to optimize their health. And I think that's very important because we have to start in a very evidence-based way, academically driven, to then change the healthcare system from inner out. So being based in hospitals. Next to that, we of course have the excitement of private clinics, which are not yet regulated, but the Health and Longevity Medicine Society is working on regulation, writing scope of practices to really define what is health and longevity. And there you see, coming back to the investment, a huge amount of investment, because we assume that there's a huge consumer need. And we just in Singapore evaluated and questioned, is there a consumer need? And we had a survey of the general population, and 60% of the Singapore population would be very interested to come to a health and longevity medicine clinic. So really understanding already the concept of optimizing the health and therewith a risk reduction of decline.
Yeah, I mean, that's fascinating. I mean, speak to any human, right? They're going to want to live a long and healthy life, right? But of course, it's how you transition into that. And you mentioned that you're working on standards, which I think is really, I've been in different industries at different stages. There's always a point where whether you're competing, whether you're collaborating, you need to set standards, right? So is that something that's coming now in the industry?
Yes, absolutely. So the first standard of the scope of practice is ready, has been submitted. So now in the negotiation phase, if this is really the standard, but absolutely, we need to have guidelines, what to do, what not to do. I don't say that everything has to be regulated in the health longevity medicine arena, but if we want to really to take this seriously and we want to bring it into precision medicine into the field, we have to set the standards, which means that we need the highest level of evidence from research going into randomized controlled trials in humans, not only animal models, but especially humans. And especially then not forgetting the implementation science component, that in the end, we know how to roll it out, because 100% of the population is aging. Many of them in a couple of countries already want that type of treatment and diagnostics. So we just have to be prepared. At the moment, I must say we are not prepared yet, because we are in the infancies of the speciality. We are learning what to do, but that would absolutely change in the next coming 5 to 10 years.
Yeah, and that's the thing that excites me the most, really. Once we have those standards in place, that's the trigger for growth, right? So I think that we all feel that with the science that's happening in the space and the activity that's going on and the capital that's coming in, and obviously the investors that we'll see at the Longevity Investors Conference in Gstaad, is the fact that everything's starting to happen now, and we've been in it a while, and it's a delight to see it all happening out there. So let's maybe, Andrea, you're always out there. You're seeing a lot of exciting technologies, whether they're kind of longevity now, like supplements and diagnostics, or the upstream activity is what's coming to us in terms of cellular reprogramming and use of existing drugs as therapeutics for longevity. What are you seeing out there? What's exciting you at the moment?
So first of all, it's happening at this moment in time in humans. So that's very exciting already. But drilling a little bit down, what I'm most excited of, and I think there's a huge potential, is the matchmaking between we are measuring something and we're doing something very specific, which is relevant to that individual. So we now understand with the biomarkers of aging, we have the diagnostic phase. So we can diagnose what kind of type of aging is going on in an individual. And that's very important because then we can matchmake it with a certain intervention to be very specific to that individual. And that's what we have to prove. So that's one thing. The other thing I would say that we really invest into understanding the mechanisms of aging much, much better. So we have lots of trials now around the world with repurposing drugs, but I think the small molecules, the new molecules, testing them will really be a game changer. Now we are at the phase of really testing. Can we do it? How much is the effect size? How much can we really manipulate the aging process? Waiting for the new molecules, which might be much, much more potent.
Yeah, and of course, there's the new molecules and the existing ones, right? So we've seen a lot of very interesting movement behind GLP-1s and their alignment with what may be happening in terms of the aging process. But of course, NUS is a very active university. You're very active as well. Is there anything you can share about the recent work that you've been doing? Anything exciting that you'll be telling us at the conference, perhaps?
Oh, absolutely. So we are really changing from doing randomized control trials where you always have a big group, then you're splitting them up and you give a placebo to one group and the other group. We are now really switching to a personalized neuromedicine approach where we do an N is one approach. So an individual is the own control and we are really titrating what we do to the phenotype of the individual, which means that we are really moving the needle into a geromedicine, precision geromedicine approach. So I think that's really the future because we as human beings, as individuals, we are very unique and understanding the uniqueness is very important to be most successful.
Great. Well, Andrea, we're going to be seeing you in a few weeks' time, and it's always a pleasure to see you. And thanks for joining us today. And best of luck to you and your team with all the great work you're doing.
Thank you so much, Phil. Great meeting you.